been many speculations in the last couple of weeks about angiotensin converting enzyme inhibitor, also known as ACE inhibitors, in regards to their functionality. Joining us in the studio today is Dr. Selman, who will clear up any speculations on the topic and deliver the truth about ACE inhibitors. Welcome, Doctor. So, are ACE inhibitors really ACE?
Well, the ACE inhibitors have been used since the 1980s. But to fully understand how they work, we need to discuss an important system, the renin-angiotensin-aldosterone system, or RAS for short. The RAS cascade begins with juxtaglomerular cells in the kidney secrete renin in response to decreased blood flow to the kidney, decreased sodium, and sympathetic activation. Renin converts angiotensinogen that is produced by the liver to angiotensin 1, A1. Angiotensin converting enzyme, or ACE, cleaves A1 to generate angiotensin 2, A2. A2 is a promoter of increasing blood pressure by means of vasoconstriction and increasing sympathetic activity. Additionally, A2 stimulates secretion of antidiuretic hormone, ADH, which results in increased blood volume. A2 also triggers the release of aldosterone from the adrenal cortex. This contributes to electrolyte and water balance in the body, thus reabsorbing sodium and water. A2 promotes hypertrophic effects on smooth muscle cells. Furthermore, A2 results in the reabsorption of salt and excretion of potassium, similarly to aldosterone. A negative feedback system is established once the desired blood pressure is achieved. The juxtaglomerular cells sense this and decrease the production of renin, and the cascade stops.
So now that we understand how the RAS system works, how do ACE inhibitors come into play?
ACE inhibitors work basically by competitively binding to the active site on the ACE. This inhibits a key step in RAS, which is the conversion of A1 to A2. This results in the inhibition of ACE in the RAS cascade that decreases activity of vasoconstrictive vessels, salt retention, and growth properties. In addition, there is an increase of a protein called bradykinin because it is not broken down by the ACE, whilst the active site is blocked by the ACE inhibitor. This results in a dilating effect that gives a stronger effect on the ACE inhibitor. Previous effects mentioned will cause a drastic drop in blood pressure to you hypertensive patients out there, especially if your RAS cascade is overstimulated. Particularly, the ACE inhibitors target more vascular dense areas such as the brain, heart, kidney, which will prevent stroke, heart attack, and kidney disease.
Well, that sounds great. So who can benefit from these products?
Well, in addition to treating majority of hypertensive conditions, ACE inhibitors indicate for treatment of patients with congestive heart failure, left ventricle dysfunction, atherosclerosis, diabetic nephropathy, those with high risk of coronary heart disease, dilated cardiomyopathy, kidney disease, glaucoma, and risk of stroke.
Come on, it sounds too good to be true. What's the catch, Dr. Selman?
Well, look, since they were established, there have been some complications that have arisen from this drug. ACE inhibitors are contraindicated in pregnancies due to their fetal toxicity. It is also known that the ACE inhibitors demonstrate persistent coughs or hives independent of dose. There's also an issue with increased potassium and reabsorption in the kidney, and hypertension, which is due to severe volume depletion and salt depletion. And some adverse effects include concurrent administration of potassium supplements, potassium-sparing diuretics, or salt substituents, which precipitate hyperkalemia. Now, that is when you have too much potassium in your body. Non-steroidal anti-inflammatory drugs diminish effects of the ACE inhibitors, so you wouldn't take it in conjunction with something like ibuprofen.
But I was told that these were ACE.
Well, they do have a considerable amount of advantages. So studies have shown that the mortality for congestive heart failure are significantly reduced by ACE inhibitors. Also, ACE inhibitors have kidney protective properties. ACE inhibitors potentiate for the hypotensive vasodilatory effects of bradykinin in the body, which reduces blood pressure. And there is a great diversity of ACE inhibitor drug types that differ in their pharmacological effects that can be tailored to all types of people. They are also really inexpensive, should I say, for the folks who are on the edge of their seats. So you're probably looking to grab a pack for about $30 to $40, depending on your pharmaceutical store.
Where can we get these from, Doctor?
Well, guys, for a special offer today only, we are giving away a full pack of our captopril version ACE inhibitor. Now, just as a fair warning, you may want to speak to your medical practitioner or your local pharmacy to determine whether this product is suitable for you, as I am neither a licensed doctor nor is this a real talk show, and what we may say may land you in hospital.